Hey everyone, my name is Coleman Mills and I'm the program manager of the Duke Teen and Young Adult Oncology program. I have the pleasure of having two medical experts with me today, Dr. Rachel Greenup, who is a breast surgical oncologist and a teen and young adult physician champion in the Duke Cancer Institute, and Dr. Lars Wagner, who is a pediatric oncologist and the teen and young adult physician champion in the Duke Children's Hospital and Health Center. So Dr. Greenup and Dr. Wagner will address some questions around what a teen and young adult program is and why it's so important. So for the first question we have is discuss the common gaps in care or services for this patient population. And Dr. Greenup will go first.
Well, thank you, Coleman. Many of our adult cancer patients are diagnosed with cancer later in their lives, in their 6th or 7th decade. And young adults in their 20s and 30s often have very different competing needs. They have children at home or are in the middle of growing their careers. They tend to have fewer financial resources set aside at this stage of life, and they have different needs, things like fertility preservation. Their quality of life issues are different. And so having a program dedicated to support patients at different stages is really important.
I would echo what Dr. Greenup had said, that I think this population is really unique. They do not fit in nicely with older adults that may have prostate cancer or lung cancer, and they don't fit in nicely with little kids that may have leukemia or other common childhood cancers. And so they're a distinct group. They have different psychosocial needs. They have different financial situations. And many times the medical conditions that they have behave differently than those seen with the same type of cancer, either in little kids or in adults. So this is a really unique population that needs a special approach.
All right, thank you. So the second question is, what are the unique challenges in caring for teen and young adult oncology patients and recommendations for how TYAO programs can help to address these?
Well, as I mentioned previously, many young adults have other demands on their time, both from a professional standpoint, a family standpoint, and a financial standpoint, that adults in their later years have often been freed from. For example, the caregiving needs for young parents can be very challenging as they're trying to navigate their own cancer treatment in a way that adults in their 60s or 70s are less likely to have to tend to. I also think that it's alienating for many young adults with cancer, and that the survivorship groups or the support groups are really focused on and aim to support older adult cancer patients. So my young breast cancer patients will often tell me that when they go attend breast cancer support groups, they do feel really out of place, in that the challenges they are personally facing are quite different than the rest of the support groups.
Oh, I definitely have seen that patients that we care for on the pediatric side can certainly feel kind of out of sorts, or things are different than they are for the younger patients that we care for. And so a real specialized approach is really critical. Specialized to meet their psychosocial needs, the needs for connection with other people going through a similar process in the teen and young adult population, and to meet the unique psychosocial concerns and problems that are created by having a cancer diagnosis when all of their peers are out living their lives and starting families and starting careers and kind of moving on with their lives. So it's a really challenging situation. And so it's important to have a real focus and intentional approach for this patient population.
Great, thank you. And so the final question we have is, why is having a teen and young adult oncology program important and why it's needed?
I think it's really important, not only around the time of cancer diagnosis and during active treatment, but also as we bridge patients from active treatment towards survivorship. Their unique needs transition as well, in that older adult cancer patients, when treatment is over, can often go back to their medical home, seeing their primary care physician or their cardiologist, for example, where young adult cancer patients have otherwise been healthy prior to their cancer diagnosis, and thus they're really left needing some support system to transition them in their new normal state of health after cancer treatment. Some of these things include issues around fertility, issues around cardiac changes related to their cancer treatment, and support from cardio-oncology. Some of this is related to changes in their overall body weight and need to maintain and protect their health moving forward. And then also transitioning back towards normal screening that comes as all young adults age into their 30s and 40s. I also think the emotional and psychological needs after cancer treatment are really important, in that this is a really traumatic event for people at a time in their life when they are supposed to be healthy. And our cancer patients after treatment need to remember that this is something they will think about and in some ways be defined by for the rest of their lives. So the program we have at Duke can help support them from diagnosis through survivorship.
In addition to those psychological and fertility and survivorship needs that we're trying to address, which are all very critical for this population, we need to engage teen and young adult patients in clinical research more. The advances that have been seen in cancer research have been tremendous for young children and even for middle-aged and older adults. And one reason that those advances are seen is because the engagement in clinical research is much higher for those populations than it is for teen and young adults. And that gap between 15 and 29 years of age is one of the lowest groups of patients that engage in clinical research. And so we can't make advances, we can't make improvements in their outcomes unless these patients are engaged in research. So we need to be very intentional about offering clinical research opportunities for these patients, to have things available for them and to reach out and try to get them engaged in this process so we can learn more and make further advances. And those clinical research opportunities can be not just in new therapies, but also understanding the biology of their disease, learning more about how having breast cancer at age 22 may be different than at 52, or different than other patient age populations. And finally, psychosocial research is very important too. We're trying to learn with every patient that we take care of so we can do a better job for the next one. And so in engagement in research efforts through a focused TYAO program is very important to improving the outcome for these patients.
All right. Well, thank you both, Dr. Greenup and Dr. Wagner, for taking the time with us today. This was a great discussion around the need for a program specifically for teen and young adult cancer patients and why we have established a TYAO program here at Duke. If you would like to learn more about the Duke TYAO program and the services we provide, please go to dukecancerinstitute.org/TYAO.